welcome all to this session about how to prepare for part 1 of MRCOG. Okay. So when you start preparing for the part 1 of MRCOG examination, so this particular figure you should see carefully and what is written here. Before you start anything, learn how to finish it. Okay, suppose you have started painting this particular room, and if you do not know how you are going to finish, your situation will be like this particular person who has finished, but he is not able to finish the end part. Okay, so because syllabus is such a vast syllabus for part 1, you need to know how to go ahead with the preparation. Okay, so there are certain do's and don'ts, especially for my online class. I always tell that you have to be punctual, and you need to log in on time. Then check your tech, that is ensure that you have got good internet, microphone, webcam, etc., which are working. Then you need to participate very actively, and you need to mute yourself when you are not talking, and you need to unmute, so that you need to work it very wisely and follow etiquettes like be respectful, use polite language, avoid using all caps when you are writing something. No, all caps, it's not it's distracting basically. And certain don'ts, like avoid distractions like other social media, texting, etc., etc. Don't be disrespectful, don't hesitate to ask for help. Okay, don't ignore deadlines. This is the most important thing for any of the part which you are preparing. No, don't ignore the deadlines. Okay, so there will always be the deadline for sending the application for eligibility, then deadline for uh, expression of interest, deadline for booking the examination. So never miss any deadline. Okay, don't share your personal information whenever you are having online learning. Okay, so these are certain things which are very important. Now we have seen about paper 1 and paper 2 and the distribution. Like paper 1 will have 100 sbs, and these modules which are covered in paper 1 are anatomy and embryology, physiology, biochemistry, endocrinology, epidemiology, and biostatistics and genetics, out of which anatomy and embryology is contributing almost 35 or 25 to 37 percentage of sbs are asked. That is one third of your paper 1. Okay, and physiology, epidemiology, and biostatistics, they will also carry around 12 to 15%. Rest of the modules approximately 8 to 11%. Okay, then paper 2, again 100 sbs are there, and the modules are pharmacology, microbiology, immunology, biophysics, pathology, clinical management, and data interpretation, out of which here the clinical management carries a lot of weightage. Almost 20 to 23% of sbs are there here. And these particular modules are very important, and each module, what are the concepts which are expected from you by the RCOG, that is very important. So when you prepare a particular module, whether you have covered and understood properly those concepts or not, that is what is going to be very, very important. Okay, now we'll see each and every module and what are the different concepts which the RCOG expecting. So this particular anatomy module is around alone will have 15 to 18 sbs, and they are expecting you to know about anatomy of anterior abdominal wall, that is anatomy, muscle actions, nerve supply, blood supply, etc., inguinal canal, femoral canal, hernia, brachial plexus anatomy and relevant injuries, anatomy of pelvis, pelvic diaphragm, then pelvic blood vessels, uterus, tubes, ovaries, their blood supply, nerve supply, iliacorectal fossa, fetal skull, maternal pelvis, we have seen perineum, vulva, vagina. These are the different topics from the anatomy. So anatomy and all these basic subjects which are related to the obstetrics and gynecology, they are expecting from you. Okay, now coming to the embryology, embryology will have around 8 to 10 sbs, and along with anatomy there will be around 30% of weightage. Okay, in the final. So the subtopics in the embryology which are expected are gametogenesis, that is oogenesis and spermatogenesis, then fertilization, implantation, first week, second week, third week of development, and gastrulation, neurulation concept, somite formation, development of various organ systems like cardiovascular system, reproductive system, renal system development, CNS, GIT development, and pharyngeal arches. Okay, so these are the different concepts or the subtopics which are expected in the embryology. Coming to the physiology, we'll have around 10 to 12 SBS. They are expecting questions on acid base balance, Physiological changes in pregnancy like cardiovascular system, respiratory system, gastrointestinal tract, genitourinary tract, calcium homeostasis, physiology of labor, menstruation, ovarian cycle, placental physiology, fetal circulation. Okay. Then coming to the next module, that is endocrinology. This will also have around 10 to 12 SBS, and the concepts which are covered are concept of hypothalamo pituitary axis, then role of hypothalamus, hormones of anterior pituitary, posterior pituitary, thyroid hormones and related disorders, adrenal hormones and related disorders like Addison's, Cushing's, Conn syndrome, pheochromocytoma, then placental hormones, hormonal control of puberty, menopause, infertility, labor and lactation. These are covered in the endocrinology. Then next module is a biochemistry. This is one of the module which most of the students find it difficult, but you will have a very specific questions which are frequently asked. The concepts do get repeated. Okay, around 8 to 10 SBS are there on biochemistry. They are expecting the carbohydrate metabolism, lipid metabolism, protein metabolism, Krebs cycle, ketone bodies formation, amino acid pool, essential and non-essential amino acids, role of proteins, glycogen storage diseases, digestion of various macronutrients, urea cycle, vitamins, LFTs, and renal function tests. So these are the subtopics which are covered in the biochemistry module. Okay. Next module is a pathology module. This is also one of the important module, and it will have around 10 to 15 SBS single based answer questions. Then what are the other topics which are covered? Cell injury, wound healing, neoplasia, coagulation abnormalities, blood transfusion, shock, various obstetrical disorders like preeclampsia, eclampsia, HELP syndrome, acute fatty liver of pregnancy, gynecological conditions affecting the genital tracts, both benign and malignant conditions of tubes, ovaries, cervix, uterus. They are covered in the pathology module. Okay. Next important module is a pharmacology. Around 10 to 12 single based answer questions are asked, and mainly the drugs like oxytocics and tocolytic agents, anticonvulsants, antiepileptics, antiasthmatics, anti-cancer agents, antibiotics, oral contraceptive pills, drugs used in abortion, teratogenic drugs, anticoagulants, biological agents, and antiretroviral drugs. So these are this is the scope for the pharmacology module. Okay. Now biophysics will have 5 to 8 SBS. Again, here the recalls will help you for preparation because most of the concepts do get repeated. Okay, so electrosurgery, electrocautery, they are asking types of current. Sonography very frequently asked. Then various special investigations such as CT, MRI, laser, radiotherapy. So these topics are covered in the biophysics. Okay. Then another important module is a genetics. It will also have around 5 to 8 SBS single best answer questions, in which they are asking about the Mendelian inheritance, autosomal dominant, autosomal recessive, X-linked inheritance patterns, both autosomal and sex-linked disorders generally asked. Then non-Mendelian inheritance such as mitochondrial inheritance, genomic imprinting like Prader-Willi or Angelman syndromes, then prenatal genetics and diagnosis, pre-implantation genetic testing (PGT) is covered. Then NIPT, non-invasive prenatal testing, Coriolis sampling, amniocentesis, maternal serum screening, nipple test, combined test, etc. They are asking. Then PGTA for aneuploidy, then pre-implantation genetic testing for monogenic disorders and for structural rearrangement, that is PGTM and PGTSR. Okay, chromosomal abnormalities, numerical abnormalities, aneuploidy like trisomy 21, 18, 13, that is Turner's Klinefelter syndrome, etc., polyploidy, etc. So this is what is the scope of genetics module. Okay. Then coming to the microbiology, it will have 12 to 15 SBS. Bacterial infections like group B streptococci, listeriosis, syphilis. Very frequently asked is the syphilis and group B streptococci. Okay, viral infections like torch infections, HIV, Australia antigen, parvo B19, fetal complications, then fungal infections such as candidiasis in pregnancy, parasitic infections like toxoplasmosis, and various sexually transmitted diseases like chlamydia, Neisseria gonorrhea, mycoplasma, HPV, HSV, HIV in pregnancy, Trichomonas vaginalis, and treatment of these conditions. Okay. Next important topic is immunology. Immunology will have around 8 to 10 SBAs, and the subtopics which are covered in this immunology module are they are expecting or they are asking questions on innate immunity and adaptive immunity, components of immune system like macrophages, neutrophils, dendritic cells, natural killer cells, etc. Components of adaptive immune system like T cells, B cells, antigen presenting cells, cytokines, and their role in immunity. Then immunological aspects of pregnancy, maternal fetal immune tolerance, role of placenta in immune regulation, changes in maternal immunity during pregnancy, immunopathology of pregnancy related conditions like recurrent miscarriages, preeclampsia, hypersensitivity and autoimmune disorders. There are various types of hypersensitivity reactions, type 1 to type 4. Autoimmune disease relevant to the obstetrics and gynecology like antiphospholipid antibody syndrome, lupus, etc. These are asked in the immunology. Then immunology of infections in pregnancy, immune response to infections, vaccination principles and use in pregnancy like influenza, pertussis. These vaccines are frequently asked. Then congenital and perinatal infections like torch infections, transplantation and reproductive immunology, such as immunological aspects of organ and stem cell transplantation, immunological causes of infertility, HLA compatibility, and its levels. Okay, and these all topics will be covered in our live sessions. Okay. Then next and most important topic is a biostatistics. This is one of the important topic for part 1 as well as part 2. They will have a 12 to 15% weightage of single based answer question. So they are expecting basic statistical concepts such as types of data, qualitative, that is categorical, versus quantitative, that is numerical, then discrete and continuous variables, measures of central tendency such as mean, mode, median, measures of dispersion like range, variance, standard deviation, interquartile range, probability and distribution, concept of probability, then sensitivity, specificity, and positive predictive value as well as negative predictive value, and likelihood ratios very frequently asked in this particular part 1 as well as part 2 examination. Normal distribution and skewness, properties of normal or Gaussian curve distribution, interpretation of bell curve, standard deviation and z-scores, statistical test and hypothesis testing, types of errors, that is type 1 and type 2 errors they are asking, then p-values, confidence intervals, okay, chi-square test, t-test, ANOVA test. So these all tests we are going to cover in our live session, and this is going to be a very easy session, and you will score maximum in this biostatistics once you prepare it methodically. Okay. Another most important module is a data interpretation. It will have around 15 to 18 SBAs. So here, uh, interpreting and screening and surveillance data, such as Down syndrome screening test, like combined test or quadruple test, understanding risk in pregnancy related pregnancy, that is relative risk, odds ratio, absolute risk reduction, ABG analysis, NST, ECG interpretation, then oxygen dissociation curve, calculation of the RMI, risk of malignancy index, then aerodynamics, Apgar score, Bishop score, semen analysis. So these are the various topics they are expecting in the data interpretation. So these are the various resources, various books are available. These books are available in the Amazon also. Soft copies are also available. Then what are the do's and don'ts? Do's are, you start your preparation with positive attitude. Collect all resources and keep it organized. Okay. Have your own schedule of study. Focus on last 5 years recalls and revise SBAs at least 3 times. Then what are the don'ts? Don't wait till the last day for booking examination. Don't leave any topic as optional. All modules are important. Okay. So you should solve all the questions. Don't revise all books for final revision. Go through only notes. Okay. So your notes are going to be very, very important. And most of the time, whenever there will be live session, it will be conducted. You just go through the PPTs which will be uploaded on the website. Okay, then don't read till the last minutes, and don't leave any question unanswered, because there is no negative marking, so you should not leave any question unanswered. Okay, now next what we are going to see, how to study. Okay, get used to the e-learning. Use soft copies, use tablet and mobile for your learning. Follow schedule and study module wise. Don't study haphazardly, always study module wise. You'll be confident that I have covered anatomy module, I have covered pharmacology module, and we have also discussed what are the concepts which are expected. So 90-95% concepts will be same what is discussed in the live session. Okay, so more time for modules with higher percentage of SBS. As I have already mentioned, what is the weightage for each module? So anatomy and embryology carries more weightage, so you should give more time for these modules. Okay, like biophysics will have 7 to 8 SBS, so you just, even if you cover recalls only, almost 60-70% will be recalls. Okay, so it will be very easy in a short time prepare those modules. But those who have long higher weightage, you give more time. Okay, you need to have your own notes and be active in the group, and complete daily tasks given in the group, like single based answer question. Okay, there may be some video which is posted in the group, or document which is related to the ongoing module. Some theory will be article will be posted, so you need to read that article on that day only. Okay, live, there will be live session on the weekend, so those who are registered can attend the live sessions, and these, most of the live sessions are free for our students. Then question bank from the website on the same module. We have got this particular platform in which there will be either mock examination or module wise SBS will be there. So you read the theory, then listen to the session and solve the SBS on our website. Okay, so give time for the revision, concentrate on the recalls. We are going to cover at least 3 to 5 years of recalls before our examination. There will be separate recall session in our last 1 month. Okay, last 1 to 2 months you need to study at least 2 to 3 hours per day, and attempt periodic mock on the website, which will be posted once a month. Okay, so this is the way you should prepare for your examination. Tips and tricks will work only when you have studied the subject carefully. Mnemonics will be told during the live sessions. Okay, recalls we are going to cover. The exam wall is very, very important, because that will help you in a short preparation. You need to be consistent and persistent in your efforts. Mentorship definitely helps, and always study in the groups. Okay, so these are certain advantages and disadvantages of the e-learning. So e-learning is very time saving. You can learn from anywhere. With respect to the time, it is flexible, etc. Okay, then what is the key to the success? So key to the success, you need to organize your study material, because it is a very vast syllabus. You will be given all theory books also, SBA books also. Okay, but you need to organize your study material so that you can do revise this study material in a very short time. Okay, you need to have your own schedule, and the only key for part 1, part 2, part 3 is a practice, practice and practice. You need to practice these questions, these concepts you need to practice, and you need to be consistent and persistent with your efforts. Okay, always have positive attitude. Do not stop till you achieve your goal. Okay, understand the technique of each part of the MRCG. All three parts have different way of preparation. So if you have the same kind of preparation for each part, that will not work. You need to understand what is expected in part 1, what should be the strategy for the part 1. Same thing, what is expected and what should be the strategy for part 2. Okay, so the strategy of preparation also differs in each part, that you need to understand. Okay, so dedication and determination is going to be very, very important. Prepare your own notes and give adequate time for the revision. Okay, so this is how the study wall looks like. So whenever you study, you need to keep your notes and keep that in front of your tables or study table, and make such kind of like you have your various staging and all kept ready, so you can revise them very quickly. Okay, so this is what is our schedule for January examination. So we'll be covering 17 live sessions, and there'll be all modules will be covered. You will also have access to these live sessions till the time of examinations. Also, past papers will be discussed, and the topic test will be there periodically. Okay. So that finishes how to prepare for part 1. Okay.